Thank you so much for joining us today for our final Health and Wellness Summer Series event for the summer of 2022. I am peacock proud and super elated to present a friend and colleague of mine, Candace Fortuny. So let me give you a little background about Candace. So she comes to us with over 15 years of experience working with children and as a speech language pathologist. She graduated with her bachelor's from Emory University. She got her master's of science in speech and language pathology from New York Medical College. And Candace has an extensive knowledge of experience within working with children with developmental delay. A little personal tidbit about Candace: we met at Blythedale many, many years ago. And when we saw each other in the hallways, we almost jumped on each other like, hey, you look like me, I look like you. It's so nice to see another woman of color in the rehab space and really making a difference for children with disabilities and with special needs. So I am honored to welcome her to our summer series. Hear ye her, you are in for a treat. I turn it over to you, Candace. Thank you.
Thank you so much, Dr. Mensah. Congratulations for just this organization and all of the work that it's done. It's really remarkable and tremendous. Thank you so much for having me. Again, I would like to extend my deepest appreciation to not just Dr. Mensah, but to its very talented and committed board of directors for inviting me to lecture on this important topic. I am just incredibly excited to be here. This is a topic that is very near and dear to my heart because it does involve our young people. And it really, truly does take a village to really help our children grow and to really help nurture their skills. So I'm hoping that this presentation is going to be very useful and helpful to many of us as parents and caregivers, educators, healthcare professionals. I too can remember working alongside Dr. Mensah when we were somewhere in our 20s, young clinicians in a pediatric rehab setting. And she is right, there wasn't too many of us. I think it was just the two of us, Dr. Mensah. And I remember being at bedside working with Dr. Mensah. We had a young child that we were both working with. At that time, I was working a lot with infants and toddlers, and she was working a lot with school age and adolescents. And so we were co-treating, and we were happy to be together working in the same space with this child. And I remember her expressing a very strong passion and desire to take rehab medicine and services abroad to underprivileged countries. Her passion and her yearning to do this work was palpable in that moment and very inspiring to me, who I think I was just trying to get through the 30-minute session. And Nia's, just her vision and her passion and her, her desire was just so strong. So I kind of remember Kasudi International before its conception, and to see it take root and to see it blossom the way it has over this past decade, has it been? Dr. Mensah is really just truly just incredible. So again, thank you so much for having me and for inviting me to lecture. All right, should I jump right in? All right, so today we are going to talk a lot about early identification of speech and language delays and ways to help your child develop their skills. And that also includes ways for educators to help their students develop their skills within the early child care setting, whether that be a daycare center or a preschool program. Let me see. Just to get it to the next slide. There we go. Okay. So a little bit more about me. So as Dr. Mensah mentioned, I received my Master's of Science in Speech Language Pathology from New York Medical College in 2007. I completed my clinical fellowship year and worked for over 10 years at Blythedale Children's Hospital. I have advanced diagnostic knowledge and treatment experience, performing speech language, feeding, and augmentative and alternative communication evaluations. We really serviced a very high volume of inpatient, outpatient, and day hospital patients. I have assessed patients with a broad range of neurodevelopmental disabilities, congenital disorders, and acquired brain injuries due to motor vehicle accidents, post-stroke, and post-tumor resection. I received early intervention CPSC and CSC evaluations, which we'll talk a little bit more about later, and treatment referrals from local counties, school districts, neurologists, pediatricians across our region, including the New York City Department of Education. I've also, for over 15 years, I've worked privately, providing in-home speech, language, and feeding evaluations and therapy within Westchester and Putnam counties. And I transitioned from the pediatric medical setting to the Yonkers Public School District in 2017. Yonkers is actually the 8th school district that I've worked in, but it's the first school district that I've worked for. So I am in Yonkers now, proudly in Yonkers, where I am now a full-time tenured employee. And I'm also a very proud mom of 2 very bright and amazing young boys, age 11 and 6. All right. Let's just see if we can, oh, there we go. It likes for me to click. Okay. All right. So who is this presentation for? Who is it geared toward? Okay. So this presentation can certainly, most definitely benefit parents and caregivers, pediatric healthcare professionals. So that would include pediatricians, developmental specialists, speech pathologists, OTs, PTs, early childhood care providers. So those, again, working in a daycare setting or preschool staff, and inquiring minds, people that want to know more about this topic. And you know, you'd be surprised, you know, how you can take new information and share it with your neighbor, share it with a good friend, share it with somebody in your community, and really kind of help them in some very specific way. So I'm hoping this presentation, again, is going to be useful. All right. What is a speech language pathologist? Okay, so when we hear speech language pathologist, we also hear you hear it being used as an SLP or a speech therapist. So speech language pathologists, we treat and we diagnose communication disorders. So we are really considered experts in communication. SLPs work with people of all ages, from babies to adults. We diagnose and treat many types of communication and swallowing problems. These include problems with speech, sounds, language, literacy, social communication, voice and fluency, and feeding. Okay, so when we talk about speech sounds, we're talking about how we say sounds and put sounds together into words. So other words for these problems, you might hear it referred to as articulation or phonological disorders, apraxia of speech, or dysarthria. All right, so we work with language. Okay, so we're assessing and we're treating how well a person is able to understand what they hear or read. Okay, and how a child uses words to tell others what they are thinking. We look at literacy in young people, how well they can read and write. People with speech and language disorders have trouble with reading, spelling, and writing. Social communication, that's an important one. Lots of folks don't realize, but we really specialize in social communication skills, all right, and helping young people learn the rules of social communication, like turn taking, how to talk to different people, okay, how close to stand to someone when talking, how to initiate a conversation, how to take turns during that conversation, how to maintain a topic without jumping from one topic to another. This is also referred to as pragmatics. Voice, we look at you know, whether or not we can assess and determine whether or not a person might have a voice disorder. Okay, so we look at how voices sound. We may sound hoarse or lose our voices easily, talk too loudly, or through our noses, and be unable to make specific sounds. So we assess and we treat voice disorders, along with fluency, as I mentioned. Okay, fluency, another word for fluency would be stuttering. All right, so we are specialists in that area. So stuttering, how well speech flows. Someone who stutters may repeat sounds like t-t-t-t-table, or use or pause a lot when they're talking. Many young children will go through a time in their development when they stutter, but most will outgrow it. We look at cognitive and communication skills, how well the young child's mind is working, their ability to problem solve, their ability to remember, organize their thoughts, and to be able to express their thoughts. All right, and we look very, very closely at feeding and swallowing skills. Now, not all speech and language pathologists have experience working with feeding and swallowing. There, however, are some of us who have that background and that experience due to the specific settings that we may come from. But we look a lot at, particularly in infancy, how well a baby can suck and swallow and breathe and really coordinate all of those skills for bottle feeding. All right, so a swallowing disorder, somebody who has a swallowing disorder, that issue may lead to poor nutrition, may lead them to weight loss. So these are children that might have a failure to thrive diagnosis, okay, because they're not gaining weight, they're not gaining the adequate nutrition, they don't have a very well-balanced diet, okay, and it could lead to other health problems. And you might be familiar with the word dysphagia. Okay, that's how we refer to these swallowing and these feeding problems. All right, so that tells you a little bit, or a lot rather, about a speech language pathologist. It's a pretty broad scope of practice. It's important to remember that. All right, and where do you find SLPs? So we can be found in private practices, physicians' offices, outpatient clinics, hospitals and schools, rehabilitation centers, long-term and residential healthcare facilities. Okay, so lots of different settings, which makes the field pretty attractive because you can sort of start out in a pediatric, rehab setting and then move into a school and then later decide you want to work with a geriatric population, and you could then try to obtain a job in a skilled nursing facility. So there's lots of different settings that SLPs work in. All right, so what's the difference between speech and language? All right, it's really important to recognize that there is a difference between speech and language. They're not being used interchangeably when you hear a speech language pathologist. All right, so when we're talking about speech, we're talking about how we say sounds and words, also referred to as articulation. We make speech sounds using our mouths, our lips, and our tongue. For example, we need to be able to say the R sound to say rabbit instead of wabbit. All right, so when we talk about speech, we're talking very specifically about sound production, how that young person is producing sounds. Okay, they need good sound production in order to produce their words. Okay, and those words then become phrases, and those phrases then become sentences, and then we have a very communicative, chatty child. All right, so language, when we talk about language, that refers to the words we use and how we use them to share ideas and to get what we want. Okay, so language includes what words mean, how to make new words, how to put words together, and what we should say at different times, as we talked about before, pragmatic language skills, right? And so what we say at specific times oftentimes depends on the situation or the social context that we are in. Okay, so for example, we might be polite and say, would you mind moving your foot? But if the person does not move, we may say, get off my foot or move your foot, right? So it really does, it's very situational. Again, how to put words together when we look at language. For example, in English, we say Joseph walked to the new store instead of Joseph walked store new, right? So there's a certain structure to our language, right? We want to make sure that we are able to formulate grammatically and syntactically correct sentences. All right, how to make new words. So for example, we can say friend, we can say friendly or unfriendly, and each of those words means something different, right? Each of those words carry new meaning. All right, so having trouble understanding what others say is a receptive language disorder, okay? So when we talk about receptive language, we're talking about language comprehension. Having problems sharing our thoughts, our ideas and feelings, that's an expressive language disorder. It is possible to have a receptive and an expressive language disorder, okay? But you might find that the young person's weaknesses or deficits are more within the receptive language domain. This is a person that can follow directions. They appear to understand everything, but when they go to communicate, right, and express themselves, they struggle, okay? Or a person could have very, intact expressive language skills, but struggle with really understanding what they hear, okay? Struggling in the classroom with following those directions, answering questions, really processing and understanding language is a real challenge for students with receptive language issues, okay? So we work on both receptive and expressive language. All right, does anybody have any questions in the chat room? Are we good? All right, definitely feel free to jump in if there's a question that you have. I'm happy at any point to answer a question. I really like an interactive lecture, so definitely.
Candace, I have a question.
Oh, yes, absolutely.
You mentioned language and forming language. What do you do when you have someone that has a speech language delay and their language, let's say their home language, is in a different syntax? You know how you talked about how there's a,
Yes.
subject, verb. Some languages have that in reverse, right? So I'm just,
right.
How do you manage that when you're working?
Yeah, I mean, it can be challenging and tricky. It really does depend on how it really plays out for the child, because those are rules, right? Every language has different rules, different syntactical rules. So it might be that in that child's home language, that word order, the verbs are before the nouns, or nouns are before after verbs. But we really want to kind of assess, that child within the English language, right? Because that's the dominant language spoken here, in that child's environment, in the classroom, socially. So we have to determine whether or not that home language, right, and the fact that it's ordered a little bit differently, if it's even affecting their language production. It might not be. If it is, then again, that's where a speech language pathologist would come in, and I would recommend that that child be evaluated, okay, or assessed by a bilingual speech language pathologist. All right, so a parent, an educator would probably want to specifically request or ensure that that child is evaluated by a clinician who speaks that child's home language, if possible. Right, but that's a great question, Dr. Mensah. Does anybody else have anything? All right, moving right along. All right, so how do you get referred to a speech language pathologist? Right, we know what we do, right? We know where to find us. But how can you, as a parent, how can you refer your child to a speech language pathologist if in fact you have concerns about their communication development? So the process does differ across the age of the child, the age span. So for our very young people, birth to 3, you're going to discuss your speech, language, or feeding concern with your child's pediatrician. Okay, so that's sort of your first line of defense. Your pediatrician is who you want to bring up any sort of issues or developmental concerns that you might have about your child. It's very important to remember that your pediatrician is an expert, right, in the field of development and medicine. You're an expert in your child. You know your child best, right? Pediatricians, when they're very young, they see the child, every few months, and then it goes to every 6 months, and then it's once a year, right? So you're really responsible for informing your pediatrician of any concerns that you might have, or that a teacher or a caregiver has expressed to you about your child's communication development. Okay, so if in fact there are concerns that you have, or that the pediatrician has, right, during that appointment when they meet your child and they say hello, and that child is maybe not making eye contact or really not, engaging much, if they have concern and those concerns are shared by you, your child's pediatrician can make a referral to early intervention. A parent can also contact early intervention at the city or county level to request an evaluation through early intervention. Okay. If in fact early intervention is not the route that the pediatrician or the parent wants to go in, you can seek a speech language pathology evaluation at a clinic, a medical facility, through your insurance. Okay, so most insurance plans, they do require a referral from a pediatrician to have your child assessed, right, at an outpatient clinic or a pediatric medical facility. Okay, if your child is preschool age, so age 3 to 5, your child may be eligible for preschool special education services during the school year, okay, or during the year up until they turn 3 years old, okay, through the end of that school year, that they turn 5, excuse me. Okay, so from 3 to 5, if your child is age 3 to 5, and there are communication concerns, your child might be eligible to access special education services through your home school district. Okay, so it's important that you either mail, fax, or hand deliver a letter to your school district's committee on preschool special education, all right, also referred to as CPSE. I did a lot of CPSE evaluations in my career. It's really critical that you inform your school district of any concerns that you have prior to your child entering kindergarten. All right, that's what budgets are for. School budgets are for, okay, to provide these special education services. So these providers can either come to your home and provide services, again, paid through the school district, okay, or they can come to your child's preschool, okay, wherever that might be, whether that's a daycare center, and provide those services. But it's really important that you notify the school district, and then that will start the ball rolling with the evaluation process. If your child is school age, you're going to want to discuss your concerns with your child's teacher to determine if the concerns are shared concerns. Parents and or school officials can write a letter to the school board requesting a speech and language evaluation. All right, in my career, it's the squeaky wheel that gets the oil. And oftentimes it's the parents. It's the parents who really have to, write that letter, make it known that there are concerns to the school board, to the special education department within your school district. And again, that will get the ball rolling for the Committee of Special Education to initiate the evaluation process. Okay. And you're going to want to call, you're going to want to write letters, you're going to want to follow up, send emails, and save all records. All right. And if you're going to pursue a private speech language evaluation, you might have a friend who's a speech language pathologist or somebody that came referred to you, from a friend or a family member. Those do not typically require referrals from a doctor. So your concerns as a parent or a caregiver are enough. Does anybody have any questions? All right. And we'll talk a little bit more about that birth to 3 process, okay, because that would really fall under the umbrella of early intervention. So if you have a concern about a child's development, the early intervention program can help by providing a free evaluation to find out if the child is eligible for services. Okay, so if a family member has a concern that their child is not learning, playing, growing, walking, or talking like other children their age, right? You can be referred to early intervention to have your child be assessed in whatever areas that you have concerns in. Okay. A referral to early intervention may also be appropriate if your child already carries a diagnosis, okay, already has a diagnosed condition that is likely to result in a delay in development, such as autism spectrum disorder, Down syndrome, cerebral palsy. If your child was born with any of those, a congenital condition, or was diagnosed in infant, toddlerhood, preschool age, those are definitely sort of, again, indications that you're going to want to have your child fully assessed, okay, by a speech language pathologist. All right. And again, for those school-age children, the referral must be in writing and may be made by you or a Department of Education school official. The referral itself should describe the concerns about your child's development, learning, and or behavior. State that you are requesting a special education evaluation. List any services that your child has received or is currently receiving. So your child might be receiving physical therapy, right? But your concerns are now in the communication domain. Your child is not talking like other children. They don't seem to understand what's going on in the classroom environment. Okay, so you can then bring those concerns to the attention of the school board, and they will further assess your child and determine whether or not they need to add additional services to your child's program. Okay. And just make sure that that letter always includes your name, your address, a telephone number where you can be reached, and state your preferred language if it is not in English. All right, moving right along. All right, so let's talk a little bit about typical development, right? It's a lot easier to identify speech and language delays, right, when we know what typical development looks like. Now, if it's your first child, right, or say you're someone who does not have children and you're babysitting, right, you're an aunt, you're an uncle, you might not know what typical development looks like. So let's go through some of the characteristics, things that we would expect from a child by 1 year of age. So by 1 year, most babies will look for and be able to find where a sound is coming from, right? So if a phone rings, if a dog is barking, if there's a fire truck that, you know, is passing by, that child's head will turn. They're trying to localize. They're trying to figure out where that sound is coming from. Most 1-year-olds will respond to their name most of the time when you call it. All right, they'll wave goodbye. You're working on hi, bye-bye. You'll be in the grocery store online and you'll see that little toddler waving at you. They're so excited that they learn that gesture and they're getting that response back from someone. They'll look where you point when you say, look at the airplane, right? Or look at the bird, look at the butterfly, look at that truck. Okay, they babble a lot with intonation, so their voices rise and fall a lot, almost like they're really talking. Okay, so they're sort of imitating what they're hearing, right, from adults and other young children in their environment. They're trying to take turns talking with you, so they're listening and paying attention to you when you speak. All right, and then they will continue babbling when you stop speaking back to them. So they're kind of learning the rules of conversation, right? You kind of take turns. Mama says something, I pause and listen, and then I respond with something. All right, so that reciprocity of communication emerges. All right, at 1 year of age, we would expect that a child could say dada for dad or mama for mom. We would expect that they say at least one word, right? And mama and dada are typically early words, right, that we would expect to hear. They point to items they want that are out of reach or make sounds while pointing. Okay, so they're going to gesture for things if they see their bottle or they see their Elmo or they see a preferred toy in their environment. They're going to be doing lots of reaching, okay, and pointing. And they're oftentimes going to pair those gestures with sound to communicate, I want that. That's cool. That's mine. Give me. All right. So by 2 years of age, most toddlers will point to many body parts and common objects. So if you say touch head, find your nose, show me ears, they'll begin to touch those body parts. Okay. Where's the cup? Where are your shoes? Find the ball. They'll recognize the labels, the names for those very common objects within their environment. They'll point to some pictures, right, in books, illustrations, show me the fish, where's the apple? I oftentimes like to use books that have really big pictures when I'm in therapy. Let's see here. I love this book, right? Where's the flower? Where's the butterfly? Right? At this age of 2, they should be pointing and gesturing and indicating that they know, they recognize that label, the name for that object that they heard. Okay? They're following one-step commands without a gesture, like put your cup on the table, so they don't necessarily need you to gesture, but they're starting to understand language. They can follow directions. Put your shoes on, put your hat on. They're able to say about 50 to 100 words. Right? So their vocabularies are really expanding by 2 years of age, pretty rapidly. That's a lot, 50 to 100 words. So if you know a 2-year-old who has no words, okay, a bit of a concern. Say several 2-word phrases, right? Not only are they producing lots of words, they're starting to combine these words. They're putting these words together. Okay, so 2-word phrases you might hear from a 2-year-old might be daddy go, baby mine, all gone, want up, hi mama, all done. Okay, those are common 2-word phrases. They might even have some 3-word sentences. Right? They're really learning how to combine words to express their wants and their needs. So I want juice, or you go bye-bye. And you're able to understand them, okay? But adults, familiar and unfamiliar with the child, strangers, can understand a lot of what they have to say, about half of the time. All right, moving along. Does anybody have any questions about typical language development? All right, moving right along. Right, so between 1 and 2 years, most toddlers will follow simple directions, as we discussed, first when the adult speaks and gestures, and then later with words alone. They can get objects from another room when asked. Go get your shoes, where's the ball? Get the banana. They can point to a few body parts when asked. They'll bring things to show to you. They're very interested in sharing their new experiences, their objects, things they know about, things that they like. They'll point to objects, as we discussed, so that you can name them as well. So they're not just identifying when you ask them, but they're showing you different things within their environment that they find exciting. They enjoy pretending. For example, they pretend cooking. They will use gestures and words with you, or with a favorite stuffed animal or doll, right? So these are our little cookers. They find their way in the kitchen, and they're pulling out pots and spoons, and they're mixing, and they're really trying to imitate what they see mommy and daddy and grandma do in the kitchen. All right, and at this age, between 1 and 2 years, at this stage in their development, they're learning about 1 new word per week. All right, 1 new word per week. So again, their communication, their language, their expressive language skills are expanding pretty rapidly. Okay, so your child is 1, 2 years old, right, within that age range, and you're on a visit with your pediatrician, right? A little check-in, a well check, or maybe a check that was prompted by you due to your concerns. What should you tell your doctor? Okay. When are there concerns? Sometimes, again, if you're not familiar with typical language development, you as a parent or caregiver don't even realize that there's a concern here, right? So here are some things that would be important to communicate to your pediatrician, your child's pediatrician. If your child doesn't make eye contact or cuddle like other babies, doesn't return a happy smile back to you, right? So you're doing lots of smiling, you're in their face, you're really trying to engage and elicit facial expressions and reactions from them. If they're very flat, right, and they don't seem to be responding to those facial expressions and that interaction, that's something to report to your pediatrician. If they don't seem to notice that you're in the room, okay? Lots of times children with speech and language delays or other developmental delays and diagnoses don't even know someone's in the room. They could care less. They're sort of in their own world. Those are red flags. Those are signs that, again, you want to bring to the attention of your pediatrician. Okay. They don't seem to respond to his or her name being called. Remember, we spoke about that at about a year old, 9 to 12 months, even as early as 9 to 12 months, they start to recognize their name, right? And they start to localize. If they're not even responding to their name and they're 2 years old, that's a concern. Okay. And again, as I mentioned, the child sort of acts as if he or she is in his or her own world, right? They prefer to play alone, seem to tune others out. They don't really seem to be related, right? What we call socially related. A child that's unrelated, it's just sort of kind of floating around and really doesn't seem to care or really be connected with other people in their environment or what's going on in that environment. So that's that child in the classroom who's sort of wandering around aimlessly, doesn't recognize that it's circle time and that they should be sitting down with their peers and they should be attending to their teacher. All right. So another red flag, and this is an interesting one, are the children that can say the ABCs, numbers or words to TV jingles, okay, but can't use words to ask for things he or she wants. Right. So oftentimes you'll get a parent or a caregiver says, well, she speaks, she says the ABCs and she counts and she knows all, she knows the lines to her favorite Peppa Pig episode or Danny the Tiger episode. Right. But that same child, if you ask them a simple question, a simple WH question, who, what, when, what's your name? What would you like? You give them a choice. Okay, do you want an apple or an orange? These are the children who can't seem to answer very basic questions. They can't seem to express themselves in a functional way, a functional manner, right? That's a bit of a red flag. Okay, so oftentimes children on the autism spectrum, they have that sort of rote or scripted language. They have all that stuff down, days of the week. They almost seem to speak in this sort of robotic sort of manner. But again, they don't really have a lot of spontaneous, functional language communication skills. Okay. They'll use words or phrases that are unusual for the situation or repeat scripts from TV. Right. So tell your doctor if you notice any of those in your young child or toddler. Does anybody have any questions? Any questions from the chat room? Okay, moving right along then. All right, so I put together this chart that makes it a little bit easy at a glance to look at early signs of language problems. Okay, looking at from birth to 3 years of age, right? Because that's typically when you want to start to identify that a speech or a language problem exists, right? So again, from birth to about 3 months, if your child is not smiling or playing with others, could indicate that there's something going on. 4 to 7 months, the child is not babbling, a very quiet baby, not a lot of vocal play, okay? They really should be experimenting with their vocal tract, right? And you hear a lot of, you'll even find them in their cribs, find them in their little playpen, find them on the floor, just kind of in their own little, head, but they're having fun. They're having fun with their voice and figuring out what sort of cool sounds their vocal tract can produce. 7 to 12 months, making only a few sounds, not using gestures like waving or pointing. They should be gesturing 7 to 12 months. Yeah, they should be pointing. Hi, bye, up. 7 months to 2 years, not understanding, don't seem to understand spoken language, could be indicative of a language problem. 12 to 18 months, saying only a few words, so a very restricted vocabulary, a very restricted lexicon, okay? These are children that only say a few things. Again, might be something you want to mention to your child's pediatrician. A child 1.5 years to 2 years, if they're not starting to put those 2 words together that we talked about, and they're only restricted to single words, a concern. They should be starting to put those 2 words together, right? They've acquired, right? They should have acquired many words at that point. So now we're looking for the hi, mommy, all done, one up, more cookie. 2 years, saying fewer than 50 words. 2 to 3 years, having trouble playing and talking with other children. 2.5 to 3 years, having problems with early reading and writing. So children that might not like to draw or look at books. Okay, they don't really seem to be interested or connected with things that you're trying to engage them in that involve, reading, scanning a page, or writing activities. Okay. All right, moving right along. Early signs of speech sound disorders. All right, so again, we know that language and speech are different. Speech, we're talking about articulation, how sounds are being produced, how tongue, teeth, lips, and jaw are supporting production of sound. Okay, so between 1 and 2 years of age, if your child doesn't even have the p, b, m, or w sounds and they're not producing them in the correct way most of the time, could be indicative of a speech delay. Between 2 and 3 years, if your child is not saying sounds like k, g, t, d, and n the correct way in words most of the time, so they're having some issues producing sounds in the back of their throat or sounds that involve more coordination with lips and teeth, tongue tip, d, n. Children that are hard to understand, even to people who know the child well, okay, mom, dad, babysitter, caregivers. And they're very difficult between 2 and 3 years old to understand, could be a sign of a speech sound disorder or speech delay that needs to be looked at a little bit more closely. All right, moving right along.
Good question. I know you're getting towards the end, but I wanted to ask the difference between a speech disorder, sound disorder, and a delay. Is this something having to do with like the oral structures of the mouth?
So speech and sound disorder are pretty much the same. So if you're hearing speech, sound, articulation, phonological disorder, we're really talking about the same thing. Okay.
And compared to the delay. So that's different than a delay.
Well, we're talking about, so a language delay, again, we're talking about vocabulary. We're talking about whether or not the child has words, whether they can put them together, whether they're starting to, produce phrases and sentences, how they use it within different contexts. Okay, so speech, we're talking about what our mouths are doing to help the child produce the sound, right? That's different. A child could have lots of vocabulary, right? Be putting lots of words together, forming really expanded long utterances, but be very difficult to understand. You don't know what they're saying. So what does it really matter that they're saying these, very sophisticated sentences if we haven't a clue what they're saying, right? So a child like that would have more of a speech sound or articulation concern.
Thank you.
Thank you. That's a really important question because it does get a little confusing. Okay, so children can have just speech delays, they can have just language delays, they could have speech and language delays. And again, that's what a speech language pathologist is really skilled at, being able to tease out, right? But kind of really helping the parent or caregiver understand what the concern is. All this fancy language does get kind of confusing. So it's just best to describe it to your pediatrician in the best way that you know how. And again, that pediatrician will make that referral to get your child's skills and communication development looked at more closely. Great question. All right, so moving right along. All right, so I put this together particularly for the early childhood educators and providers that might be in the room or listening. Okay, so these do apply to parents as well, but I sort of put it together in a chart format because a lot of it sort of is easy to see within that like classroom, more structured language environment. So a child struggles to imitate the sounds made by others. That's easy for like a teacher to spot out because everybody's singing and saying words and labeling pictures. And this child doesn't seem to be trying to imitate, okay? Trying to move their mouth or trying to even attend to the mouth to see, well, what do I have to do to kind of make that sound or that word happen? All right, so as a childhood educator or provider, if you find that the variety of sounds a child makes decreases instead of increases, They were saying all these words. What happened to them? I heard these sounds, then they kind of disappeared, right? That's a cause for concern. That's a sign that there's something that's going on, right? There's something going on that needs to be looked at. If the child in your infant room, toddler room, preschool room makes only a few sounds or poor quality sounds, they don't sound like the sounds that they're trying to produce. They have difficulty following those commands. Again, everybody's doing Simon Says, right? Everybody's eating their snacks. Everybody's getting ready to go outside. They're not understanding the routine. They're not following those directions to go get your coat. It's time to go. The bus is here. Slow to show an understanding of new words. Cognitive changes such as decreased memory or problem-solving skills. Had seemed to remember it one day. I taught little Nicole, a lesson, or she seemed to understand how to count from 1 to 10 one day, but the next day she just lost it. She doesn't seem to be able to retain information, right? Newly learned information. Has difficulties communicating basic needs. Child not combining words by 18 months of age. Again, more cookie, mama up, all done. Child stopped saying sounds or words he or she had previously mastered. Huge red flag. Right? Language seemed to be developing along that typical continuum, and something happened where now they don't have the words they once had. Okay, those are red flags. All right, moving right along. Let's see. Oh, and we have some more. The child has difficulty or is not responding to directions, questions, or conversations with others. Okay, not seeming to interact or engage very well with their peers, or during a lesson. They're not able to respond to any questions that you're asking. You're showing them pictures, you're simplifying your language, you're giving them options. They are not really able to respond. That's a cause for concern. They struggle to start a conversation or initiate conversations with others. The child has unintelligible speech after 24 months of age. So what does it mean, unintelligible, right? That's a fancy word that oftentimes people get confused. They think it's a word that's referring to the child's cognition or level of intelligence. When we talk about unintelligibility or intelligibility, we're just simply talking about how easily that child can be understood by others. Okay, so if a child cannot be understood after 24 months, the child is 2.5, and nobody understands what this child has a lot to say, but nobody understands, right? Those who are familiar with the child, they don't have a clue. That's an early sign of a speech delay. Not speaking in sentences by 36 months of age. Again, they're supposed to be combining words. We want phrases and sentences. The child is not fluently speaking by 3.5 years of age, or the child has changes in their communication or cognition following an injury or surgery. Okay, so we saw a lot of that, Dr. Mensah, in our pediatric rehab setting. Okay, those children that may have been a victim of a car accident or some sort of brain injury, where they had communication and they lost it, a post-stroke.
And we have a few comments and questions in the chat. So absolutely. I know we're nearing the end of the hour. Would you like us to address those now, or do you want to wrap up?
Yes, absolutely. Oh my goodness, the hour flew by. Yes, let's wrap up. I mean, I can certainly address those.
I'll ask you the questions, and then I'll let you go and get towards the last few. So
okay.
Libby Jackson asked a few really good questions. How do you know if the issue isn't a hearing issue? Is the first one she asked.
How do you know if the issue isn't a hearing issue? Well, the only way to determine whether or not a child has a hearing issue is to have that child evaluated by an audiologist. Okay, that's a really important question that you ask, because when a child has an expressive language delay, it's really important to get their hearing looked at to determine whether or not the child has a hearing impairment that's contributing to the speech or language delay. Okay, so a good pediatrician, if there's an expressive language delay, that's one of the first things they're going to look at. They're going to look at that newborn hearing screen. They're going to want to refer that child to an audiologist so that we have a baseline. We know what that child's hearing acuity is like.
We have another question. Thank you. That was excellent. Do you find that there may be a correlation between a child's vision or hearing that is impacting their ability to speak?
Absolutely, positively, right? Because that child is not experiencing their environment in a way that a normally or typically developing child would, right? They don't have access to a lot of that visual input so they can learn what things look like. They don't have that, right? So that their language is going to kind of lag behind their peers.
Okay, awesome. And there was one more. How does one get the pediatrician to create a cross-discipline plan for the child?
Ooh, that's a great one. A cross-discipline. Well, it's depending on that child's age, right? If the child is being referred to early intervention, it's going to be the early intervention team, those groups of specialists they're going to be the ones that develop a individualized family service plan. Okay, they're going to assess those different domains. So if your child also has physical, motoric, impairments, and it's going to be referred to for physical therapy, then now you have a physical therapy on board. The speech and language pathologist determines if the child has a speech and language delay. And then you're going to have meetings periodically where all of those professionals are going to come together, and you're going to talk about your child's areas of concern, their progress, et cetera.
Thank you so much. So, and don't worry about going a little bit over the hour. If you have to go, any of our listeners have to go, we will have this content recorded on our YouTube channel. So I do think it's very important information. So Candace, please continue. And if you have to go, thank you for joining us this time, for this hour, as we conclude our health and wellness series. We're going to continue to learn more about speech delays with Candace Fortuny. Thank you all. And Candace, please continue.
Okay, absolutely. So I do have a little bit more, but I will kind of pace myself so that I can kind of get through these slides. How common are language delays? So 1 out of 5 children will learn to talk or use words later than other children their age. So it's relatively common. Some children will also show behavioral problems. These kids get very frustrated because they're not able to get their needs and their wants met. So these are the kids that are tantruming, falling to the floor, maybe crying a lot because they don't have the words to communicate and express themselves. Simple speech delays are sometimes temporary. Okay, so having a speech and language delay, it just might mean that the child just needs to be read to a little bit more, or a little bit more, interaction, narrating their play and going on more family field trips. And then they sort of just kind of advance and they're kind of, at the same level as their peers. So it could be temporary, or they may resolve on their own, or just with a little extra help from a family or a little therapy oftentimes. All right, so implications of speech and language delays, what could it mean? So someone had asked about a hearing impairment. Absolutely, it could totally indicate that there's something going on with that child's hearing. So very important to get that child's hearing assessed by an audiologist. It could indicate that there's a developmental delay. So there's skill delays in other areas, physical delays, vision delays, vision issues. So hearing also, it could indicate that there's something going on at a more neurological level, a neurological based disorder, okay? Referred to, we know as autism spectrum disorder. It could be that, and I know it's a scary word, in these times where there is such a high prevalence of that diagnosis, but it could indicate, that's why it's so important to rule out something like that, and to kind of get your child's skills looked at more closely by an expert. It could indicate learning disability, right? And those things are not typically revealed until that child enters school and they're in that academic setting and they have to perform and keep up with their peers, curriculum, and keep up with their peers, their same age peers. What is early intervention? I said we'd talk a little bit more about early intervention. So early intervention is a term used to describe the services and supports that are available to eligible infants and toddlers with developmental delays and disabilities and their families. So early intervention may include services like speech therapy, physical therapy, occupational therapy, assistive technology, special instruction, vision services, and other types of services based on the needs of the child and the family. Again, that's what the early intervention team will determine, what sort of services your child needs or is eligible for. And these services can have a very significant impact on a child's ability to learn new skills and overcome challenges. Programs are available in every state and territory. These are publicly funded programs that provide services for free or at a reduced cost for any child who is eligible. The New York State Early Intervention Program is part of the National Early Intervention Program for infants and toddlers with disabilities and their families. Okay. And so that really falls under that umbrella of the IDEA, the Individuals with Disabilities Education Act, which was created in 1986. Very important to know, early intervention is out there. Excellent services that your child can have access to. Okay, so eligibility for EI is based on an evaluation, as we talked about, of your child's skills and abilities. A doctor referral is not necessary. So if your doctor is not able to connect you, you can reach out yourself. If your child is under 3 years of age, call your state or territory's early intervention program official for information about your local program. So it does vary, okay, based on where you live, whether that be in the city or which county you live in. Contact the New York State Department of Health. I have the contact information here and the email address. As a parent, you might say, I have concerns about my child's development, and I would like to have my child evaluated to find out if he or she is eligible for early intervention services. I put that language in there because sometimes parents just don't know exactly what they should say to get the child the help and the support and the attention that they need. Okay. I like this one. I put this in here because it's really important. What to do if your doctor tells you not to worry, but you are still concerned, right? Again, it's that gut, right? Parents know their children better than anybody. When it's not sitting well with you that your child's development is not progressing the way other children your child's same age are, it's a concern. It's unsettling. Okay. It is okay to get a second opinion. You can ask your child's doctor for referral to a developmental specialist or a speech and language pathologist. You, again, can also contact early intervention yourself for an evaluation. If your child is younger than 3 or your child's school district, as we talked about, if he or she is older than 3. Also, it is important to remember this, and I'm going to say this twice. If your child is evaluated by early intervention and does not qualify for speech and language services, or whatever services you were in pursuit of, that does not mean that your child does not need speech and language therapy. Again, I'm going to repeat that. If your child is evaluated by EI and doesn't qualify for the services that you were in pursuit of, that does not mean that your child does not need the service. It just means that your child did not meet the eligibility criteria necessary to qualify for early intervention services at the time that your child was evaluated. It is important to keep in mind that the eligibility criteria for early intervention services is very stringent and oftentimes require a very severe or very significant delay in both receptive and expressive language skills. You can always pursue a speech and language evaluation privately through your medical insurance at a hospital, a clinic, or a private practice. Very important, very key. So often, I hear a parent say, well, they got evaluated by EI and they didn't qualify. So I didn't think he or she needed the services. They said that they were fine. No, they didn't say that they were fine. They were saying that they didn't meet the eligibility criteria that would enable EI services to be delivered to your child. So that's very different. We don't want to
add one thing, Candace, too?
Sure.
There are certain diagnoses that are automatic qualifiers.
Absolutely.
So that's very important to know. Prematurity, if you get an autism diagnosis, Down syndrome, there's a few automatic, you're going to get services because they know the importance of developmental. And also back to your point about at the time they were tested, right? Right. So if you test a child early enough, really young, there's less things a baby at 6 months is expected to do than a child at 1 year is expected to do, right? So because of that, the child may score, close to 50 percentile of children at 6 months. But 6 months later, that child has a greater delay because now time has passed. Yes, so you do want to continue. If you have something in your heart and your gut that's telling you, my child needs services, have them reevaluated again via EI, or just go to your pediatrician and try to get services through your medical provider.
Absolutely.
And there's a question in the chat, but what if you wait too late if the child is at 4 or 5? I'll let you go ahead and answer that one, Candace.
Sure. Well, better late than never. It could be that the child sort of missed some critical windows in their development, but it's you have to address it, right? We all have to sort of look at this child and say, okay, this child is not really, at the level that they need to be at. So we need to alert that preschool teacher, right? And start writing letters to the school district to get that child evaluated. Okay, so they may have missed some critical, that happens oftentimes, right? Everybody finally wakes up and realizes this child isn't talking, especially when they go into preschool, they go into kindergarten, right? And everybody's on one page and their child is not. That's why there's kindergarten screeners to kind of determine, to give the school an idea, who's sort of where they need to be and who is not, right? Ultimately, something has to be done. All right, so activities, I want us to kind of get to those. Activities to encourage speech and language development in children birth through 3, right? I said it early on that we would talk about ways to help your child develop their skills. So imitating actions and sounds is something that you want to encourage in your child. So have your child imitate early sounds such as ba, ma, pa, da, and na after your model. Have your child imitate actions such as clapping hands and imitating animal sounds, right? Ruff, ruff, moo, ba, ba. When I supervise a graduate student, I say, listen, if you're too cool to bark like a dog or moo like a cow or cluck like a chicken, this probably isn't the field for you, right? You're working with young children. You want to be able to get down on their level and connect with them in a very fun and meaningful way. So you kind of throw your cool card way out the window when you are working with young children. You have fun with them. It really does make a difference. You're going to want to read to your child, read books to your child frequently. Simple books, as I showed you, with colorful pictures. Look, good old Brown Bear by Eric Carle. This is a, right, big, colorful, right, with a very predictable sort of context, predictable lines. Green frog, what do you see? I see a purple cat looking at, and then you want to pause at times, me, right, because it's kind of saying the same repetitive lines over and over. You do not need to read all the words on the page of a book to your young child. Scale it down to 1 to 3 words, label the picture, describe and talk about the pictures, and have the child point to and identify common objects in the picture. So for example, Peppa Pig, popular show, right? You'll notice in this book, however, there are lots and lots of words going on the pages, right? So we have lots of words going on. So it's not important to read every word that you see here on the page. You're just going to simplify your language. So it says, one day, Peppa, George, Mommy, and Daddy Pig got into their little car and drove to their new house on top of a little green hill. That's a lot of language. We might say, Mommy and Daddy Pig drove home. Where did they drive? Home. Who drove? Oh, trying to get that Mom and Daddy in the there you go. Who drove? Mom and Daddy. Okay, simplify your language. Less is more when we're working with young children, particularly those with speech and language concerns. All right, other activities to encourage speech and language development. Talk to your child. As I mentioned, use simple vocabulary to comment or describe everyday activities, right? Set up environments or situations that tempt the child to want to speak. So eating a desired food or snack in front of them, and holding a toy a child often likes to play with out of their reach, right? Handing them the bubbles, right? Just give them the bubble wand. And they're going to be kind of like wondering, like, okay, well, they have to say bubble or open, help me, right? So you kind of put them in situations where they're stuck, right? To kind of help tempt them to want to communicate, to want to speak. Mirror talk. Have the child face the mirror. If you have a wall mirror, a bathroom mirror, a stand-up mirror, have them look at themselves. Talk to your child about what he or she sees, right? I see your eyes, right? Looking in the mirror, what do you see, right? I say their name, and we point to nose and we point to ears and eyebrows and so forth. So we have fun with mirror play, pointing those things out to our young children. All right, so here we go. Further activities, cooking and meal preparation. That's a great way to work on language. So making an ice cream sundae, there's different steps. First, we take the ice cream out, then we get the syrup, we put the bananas on, we sprinkle the sprinkles on top, Making cookies, right? There's a lot of language in there. Let's get the pan. We're going to roll, roll, roll. We're going to pat, pat, pat. Cookies on, cookies in. We're labeling objects needed, and we have the child actively involved in the preparation. There's lots of language opportunities there. Okay, singing songs and accompanying the songs with actions of the song. So simple songs, Old MacDonald song, E-I-E-I-O. I love that for just getting children who don't have much going on sound-wise, just to play with their vocal tracks and use vowel sounds, E-I-E-I-O. Wheels on the Bus, very predictable context, very predictable lines. Twinkle, twinkle, little star, so they can hear that intonation of those varied patterns. Going to the park and playground, that's a great language activity, right? Language-based, language-rich activity. There's so much in that child's environment, the swings, the slides, there's things to climb, places to jump. Most children enjoy swings and slides, and their caregiver can describe and comment on the child's activities, right? So as they're going up the slide, up, 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 and down, down the slide, or ready, set, go. There's so much opportunity for language. Okay, so activities, some more activities to encourage speech and language development. So using farmhouse animals or doll houses with figurines, okay? As a graduate student, working with young people, every graduate student has their farmhouse. We get a lot of language from the good old farmhouse, right? And all of its little figurines, it's a little pig, it's a little horse, it's a little cow, and we do lots of things with them, right? The cows eat, the horses go in the barn, they come out of the barn, right? They're sleeping. You have the child follow simple commands within their activities. If they're playing with babies or they're playing with the dollhouse and the figurines, you put the baby in the bed, you feed the cow, you put the horse in the barn. So you can also get them to do things with these figurines and kind of assess whether or not they're able to follow directions, okay? You're gonna play turn-taking activities. So rolling a ball, right? Something as simple as that. Just that back and forth, that's language development. You're playing, you're getting down in that child's level, and you're just really trying to nurture and facilitate that reciprocity, right? Give me my turn, ball, right? Blowing bubbles, picking a card from a stack, right? Everybody gets a turn. You have a group of 2 or 3 little ones. Okay, whose turn? And they get a picture, right? Oh, who's next? Just that simple, they get so excited. Oh, it's my turn to pick a card, you know, pick a card. Sometimes it's even just how you present them. If you present them in a stack or in a fan sort of layout, they get super, super happy. Listening activities that help your child attend, listen and follow directions. For example, Simon Says, touch your nose. Okay, we're looking at, again, how well that child is able to listen and comprehend, right? The language that's coming at them. Freeze dance, right? That music stops, freeze, their body has to do something. They have to respond in a specific way. I Spy with my little eye, that gets them listening and thinking and looking and trying to figure out what is being described and where it might be in the room. Okay, we're almost done. All right, so activities to encourage speech and language development in children 2 to 4 years of age. Again, a lot of what we already discussed, okay, but the child is getting a little bit older. You're going to want to make sure you're speaking clearly to your child. That might involve slowing your rate of speech down a bit, right? We're working in very fast-paced, multitasking environments, but sometimes we have to slow down for these young people, okay? They're really sort of entering that phase of early language development, and we want to make sure that they're able to process and take in all that you're kind of throwing at them. Repeat what your child says to show that you understand. Want juice? I have juice. I have apple juice. Do you want apple juice? It's okay to use baby talk sometimes. Be sure to use the adult word also. So for example, if the child is saying din, 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 din to indicate they're ready for dinner, you would say, it is time for din, din. We're gonna have dinner now, right? So you're gonna help your child understand by asking simple questions. Sometimes you can be really silly and throw them off. Is your name Mickey Mouse? Or do you eat that doggy food? And they'll say no. right? So you're kind of helping them recognize how nonsensical and how silly that question is. Or you might even grab clothing items that belong to you or an adult and say, is this your hat or your jacket, right? To elicit a yes or a no, right? A hat that's clearly too big for their heads. Is it your hat or is that mommy's hat? So you're going to ask questions that include a choice to help with language expression. So those kids who you're asking very open-ended questions to, like, what did you do today? That's so much, right? For a child who has a speech and language delay, you want to simplify it, right? Did you go outside with your friends or did you go out to play? Did you read a story, right? Play outside or a storybook? Do you want an apple or an orange? Do you want to wear your red shirt or your blue shirt? Keep it simple. Give them choices so that they can more easily access a response, right? You're really trying to elicit language, so you got to really simplify. Place familiar objects in a small bag or a box. Oh my goodness, they love this. Have your child take one out and tell you its name and how to use it, right? So I do a lot with my preschoolers. I worked at a private practice over the summer. Mystery box, like what's inside this box? So we reach in, we pull something out, we label it. Ooh. Sometimes their hands get stuck in there, like mine. And so they might pull out something fun like spider web, what is it? We label it, or a pig, okay, or a saw, and we talk about what you do with the saw. We cut with the saw. And summertime, you might get more thematic. I had a shark, so they reached in the shark, don't get bit, and they pulled out a sun, right? And we talked about how hot a sun is. They pulled out a kite, right? It flies. They love these novel and unique ways kind of label and find things and describe what they found and tell me the function of that object, what it does, where you might find it. Show pictures of familiar people and places, talk about who they are and what happened. So these days, right, the days of the photo albums are kind of far and few between. We do a lot with our cell phones, totally fine to sit and kind of scan through pictures and talk about who's in that picture, right? Is grandma in the picture? Is that your brother? Where were you? Oh, at the park, at the pool? Oh, I see you swim. You were swimming. So you're going to do a lot of that to kind of help facilitate language development, get them talking about people they know, right? Experiences that they had, things that excite them. You're going to praise your child when he or she tells you something. Show that you understand their words. I oftentimes say, I love your speech, or wow, you're really using your words today. I love that, right? You're really going to want to give them that positive reinforcement. Okay, other helpful language tips to remember. Repetition is very important. Try to exaggerate key words. Remember to use language that is clear, consistent, and simple so the child can more easily understand what is being said. Pause and allow time for the child to respond, right? Again, slowing your rate and giving them time to process and respond back to you. Make speaking and listening experiences enjoyable for your child. Be silly, laugh, and have fun. Children eat that up. You get a lot out of them when you're just being silly, you're on the floor. I don't typically wear a blazer when I'm working with the little ones. I kind of did that for Kasudi International. When I'm working with my young people, I'm on the floor with them. I'm in comfortable clothing, and you really just want to kind of enjoy the moment. Okay, and that brings us to the end. Are there any questions? Let's see, I'm going to look here in the chat.
Well, I've been monitoring the chat. It looks like
okay.
all the questions were answered. Yes. And this was an incredibly informative session. We really appreciate it. It was amazing.
Thank you.
Quite nostalgic for me because my little one is 27 now.
You never forget, right?
Yeah. But I can't wait to share this information with my social network and Christine's social network as well. Is there anyone with any further questions before we close out?
No, I have to say, as a practicing speech therapist, hi. The information was wonderfully presented, and it allowed, I used to do early intervention. I haven't done it in 20 years. So thank you for.
It was nostalgic for you too, Donna.
Exactly. It was very nostalgic. So thanks.
Absolutely. My pleasure.
So Candace, on behalf of Kasudi International, we thank you so much for this wonderful presentation, and we hope to collaborate with you again in the near future, because this was amazing.
Oh,
It was.
I'm so happy to hear that. Your work is truly remarkable and meaningful, as it provides a bridge for underserved communities to access valuable healthcare information and services that they may not have otherwise have access to. So again, congratulations to you and the other board members and Dr. Minster for all the wonderful work that you're doing in the community.
Well, thank you, and
It
thank
makes a
you
difference.
all. Thank you so much. And thank you all for joining us today. We hope you have a wonderful rest of your week, a wonderful weekend. And we look forward to seeing you at the next event sponsored by Kasudi International. Have a great day.
Thanks, you too. Bye.
Thank you.
Bye-bye.